Hey, Alpha Nurses, I'm Licensure from AlphaNursGuide.com. This is 20 practice NCLEX questions. Without the way, let's get started.
The primary health care provider determines that the fetus of a multiparous client in active labor is in distress, necessitating a cesarean birth with general anesthesia. Before the cesarean birth, the anesthesiologist prescribes cimetidine 300 milligrams PO. After administering the drug, the nurse should assess the client for reduction in which of the following? 1. Incidence of bronchospasm. 2. Oral and respiratory secretions. 3. Acid level of the stomach contents. 4. Incidence of postoperative gastric ulcer. The correct answer is 3. Cimetidine is prescribed by some anesthesiologists who will be giving a general anesthetic to reduce the level of acid in the stomach contents, altering the pH to reduce the risk of complications should aspiration of vomitus occur. Aspiration of vomitus is the 5th most common cause of maternal mortality. Most anesthesiologists insert an endotracheal tube to reduce the incidence of aspiration. Isoproterenol is used to decrease the incidence of bronchospasm. Atropine sulfate is administered to dry oral and nasal secretions. Although cimetidine is useful for gastric ulcer therapy, gastric ulcers are not a common effect associated with operative births. A nurse notices repetitive late decelerations on the fetal heart monitor. The best initial actions by the nurse include: 1. Prepare for birth, reposition patient, and begin pushing. 2. Perform sterile vaginal exam. Increase IV fluids and apply oxygen. 3. Notify the provider. Explain findings to the patient and begin pushing. 4. Reposition patient, apply oxygen, and increase IV fluids. The correct answer is 4. Late decelerations on a fetal heart monitor indicate uteroplacental insufficiency. Interventions to improve perfusion include repositioning the patient, oxygen, and IV fluids. A sterile vaginal exam is not indicated at this time. Late decelerations are not expected findings and do not indicate an imminent birth. A client with dementia who prefers to stay in his room has been brought to the day room. After 10 minutes, the client becomes agitated and retreats to his room again. The nurse decides to assess the conditions in the day room. Which is the most likely occurrence that is disturbing to this client? 1. There is only one other client in the day room. The rest are in a group session in another room. 2. There are 3 staff members and 1 primary healthcare provider in the nurse's station working on charting. 3. A relaxation tape is playing in one corner of the room, and a television airing a special on crime is playing in the opposite corner. 4. A housekeeping staff member is washing off the countertops in the kitchen, which is on the far side of the day room. The correct answer is 3. The tape and television are competing. Even conflicting stimuli, crime events portrayed on television, could be misperceived as a real threat to the client. A low number of clients in the presence of a few staff members quietly working are less intense stimuli for the client and not likely to be disturbing. The client in the early stage of Alzheimer's disease and his adult son attend an appointment at the community mental health center. While conversing with a nurse, the son states, "I'm tired of hearing about how things were 30 years ago. Why does Dad always talk about the past?" The nurse should tell the son, 1. Your dad lost his short-term memory, but he still has his long-term memory. 2. You need to be more accepting of your dad's behavior. 3. I want you to understand your dad's level of anxiety. 4. Telling your dad that you are tired of hearing about the past will help him stop. The correct answer is 1. The son's statements regarding his father's recalling past events is typical for family members of clients in the early stage of Alzheimer's disease, when recent memory is impaired. Telling the son to be more accepting is critical and not an attempt to educate. Understanding the client's level of anxiety is unrelated to memory loss of Alzheimer's disease. The client cannot stop reminiscing at will. The nurse is making a home visit with a client diagnosed with Alzheimer's disease. The client recently started on lorazepam due to increased anxiety. The nurse is cautioning the family about the use of lorazepam. The nurse should instruct the family to report which of the following significant side effects to the healthcare provider? 1. Paradoxical excitement. 2. Headache. 3. Slowing of reflexes. 4. Fatigue. The correct answer is 1. Although all the side effects listed are possible with lorazepam, paradoxical excitement is cause for immediate discontinuation of the medication. Paradoxical excitement is the opposite reaction to lorazepam than is expected. The other side effects tend to be minor and usually are transient. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguy.com. Back to the questions. A client who has a history of a mitral valve prolapse is scheduled to get her teeth cleaned. Which of the following replies by the nurse is most appropriate? 1. The physician will need to reevaluate the status of your heart condition before your dental appointment. 2. Be sure to remind your dentist that you have a heart condition. 3. It is important for you to care for your teeth because your heart condition makes you more susceptible to developing oral infections. 4. We will prescribe a prophylactic antibiotic for you to take before getting your teeth cleaned. The correct answer is 4. Clients who are at risk for developing infective endocarditis due to cardiac conditions such as mitral valve prolapse must take prophylactic antibiotics before any dental procedure that may cause bleeding. The client is not more susceptible to developing oral infections. Rather, the client is more susceptible to developing endocarditis that results from oral bacteria that enter the circulation during the dental procedure. The physician does not necessarily need to reevaluate the heart condition of a client who is stable, but antibiotics must be prescribed. It is not enough to simply remind the dentist about the heart condition. The nurse is caring for a client who has just had an upper GI endoscopy. The client's vital signs must be taken every 30 minutes for 2 hours after the procedure. The nurse assigns an unlicensed nursing personnel to take the vital signs. 1 hour later, the UAP reports a client, who was previously afebrile, has developed a temperature of 101.8 degrees Fahrenheit. What should the nurse do in response to these reported assessment data? 1. Promptly assess the client for potential perforation. 2. Tell the assistant to change thermometers and retake the temperature. 3. Plan to give the client acetaminophen to lower the temperature. 4. Ask the UAP to bathe the client with tepid water. The correct answer is 1. A sudden spike in temperature following an endoscopic procedure may indicate perforation of the GI tract. The nurse should promptly conduct a further assessment of the client, looking for further indicators of perforation, such as a sudden onset of acute upper abdominal pain, a rigid bore-like abdomen, and developing signs of shock. Telling the assistant to change thermometers is not an appropriate action and only further delays the appropriate action of assessing the client. The nurse would not administer acetaminophen without further assessment of the client or without a physician's prescription. A suspected perforation would require that the client be placed on nothing by mouth status. Asking the assistant to bathe the client before any assessment by the nurse is inappropriate. A client with a peptic ulcer has been instructed to avoid intense physical activity and stress. Which strategy should the client incorporate into the home care plan? 1. Conduct physical activity in the morning in order to be able to rest in the afternoon. 2. Have the family agree to perform the necessary yard work at home. 3. Give up jogging and substitute a less demanding hobby. 4. Incorporate periods of physical and mental rest in the daily schedule. The correct answer is 4. It would be most effective for the client to develop a health maintenance plan that incorporates regular periods of physical and mental rest in the daily schedule. Strategies should be identified to deal with the types of physical and mental stressors that the client needs to cope in the home and work environments. Scheduling physical activity to occur only in the morning would not be restful or practical. There is no need for the client to avoid yard work or jogging if these activities are not stressful. A client has a nasogastric tube following a subdural gastrectomy. The nurse should 1. Irrigate the tube with 30 milliliters of sterile water every hour if needed. 2. Reposition the tube if it is not draining well. 3. Monitor the client for nausea, vomiting, and abdominal distension. 4. Turn the machine to high suction if the drainage is sluggish on low suction. The correct answer is 3. Nausea, vomiting, or abdominal distension indicates that gas and secretions are accumulating within the gastric pouch due to impaired peristalsis or edema at the operative site and may indicate that the drainage system is not working properly. Saline solution is used to irrigate NG tubes. Hypotonic solutions, such as water, increase electrolyte loss. In addition, a physician's prescription is needed to irrigate the NG tube because this procedure could disrupt the suture line. After gastric surgery, only the surgeon repositions the NG tube because of the danger of rupturing or dislodging the suture line. The amount of suction varies with the type of tube used and is prescribed by the physician. High suction may create too much tension on the gastric suture line. When obtaining the nursing history from the mother of an infant with suspected intussusception, which of the following questions would be most helpful? 1. What do the stools look like? 2. When was the last time your child urinated? 3. Is your child eating normally? 4. Has your child had any episodes of vomiting? The correct answer is 1. For the infant with intussusception, stools characteristically have the appearance of currant jelly because of the intestinal inflammation and hemorrhage resulting from intestinal obstruction. These stools occur later in the course of the disease process. Questions that focus on urination, vomiting, and food intake do not elicit information about the effects of intussusception. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. During physical assessment of a 4-month-old infant with Hirschsprung's disease, the nurse should most likely note which of the following? 1. Scaphoid-shaped abdomen. 2. Weight less than expected for height and age. 3. Cyanosis of the fingers and toes. 4. Hyperactive deep tendon reflexes. The correct answer is 2. Infants with Hirschsprung's disease typically display failure to thrive, with poor weight gain due to malabsorption of nutrients. Therefore, the nurse would expect to see a child who weighs less than that which is expected for height and age. A distended, rather than a scaphoid-shaped, abdomen would be noted. Cyanosis of fingers and toes is associated with congenital heart disease. Hyperactive deep tendon reflexes are associated with upper motor neuron problems, such as cerebral palsy. A mother brings her 3-month-old child into the emergency department. The child is listless with dry mucous membranes, tending of the skin on the forehead, a depressed fontanelle, and a history of vomiting and diarrhea for the last 36 hours. In what order from first to last should the nurse implement the primary care provider prescriptions? 1. Obtain vital signs and weight. 2. Insert an IV and infuse fluids. 3. Apply a urine collection bag. 4. Draw blood for laboratory tests. The correct order is 1, 3, 2, and 4. The nurse should first obtain vital signs and evaluate the child for signs of shock or cardiac arrhythmias. The weight can also be obtained at this time to estimate the amount of fluid lost. The nurse should next apply the urine collection bag. As soon as possible after these steps, the nurse should insert an IV to replace lost fluids, electrolytes, and sugar to reduce the incidence of metabolic acidosis created by the lack of calorie intake and the loss of electrolytes. Blood should be drawn to assess the severity of electrolyte imbalance and other possible causes for the diarrhea and vomiting. The mother of a toddler who has just been admitted with severe dehydration secondary to gastroenteritis says that she cannot stay with her child because she has to take care of her other children at home. Which of the responses by the nurse would be most appropriate? 1. You really shouldn't leave right now. Your child is very sick. 2. I understand, but feel free to visit or call anytime to see how your child is doing. 3. It really isn't necessary to stay with your child. We'll take very good care of him. 4. Can you find someone to stay with your children? Your child needs you here. The correct answer is 2. The nurse's best course of action would be to support the mother. This is best done by conveying understanding and encouraging the mother to visit or call. Telling the mother that she shouldn't leave and that the child is very sick is critical and insensitive. Additionally, it implies guilt should the mother leave. Commenting that the child does not need anyone is not appropriate or true. Toddlers, in particular, need family members present because of the stresses associated with hospitalization. They experience separation anxiety, a normal aspect of development, and need constancy in their environment. Asking the mother to find someone else to stay with her children is inappropriate. The children at home also need the support of the mother and/or other family members to minimize the disruptions in family life resulting from the toddler's hospitalization and to maintain consistency. The mother of a toilet-trained toddler who was admitted to hospital for severe gastroenteritis and subsequent dehydration and is now at home asks the nurse why the child still wets the bed. Which of the following should be the nurse's best response? 1. Hospitalization is a traumatic experience for children. Regression is common, and it takes time for them to return to their former behavior. 2. The stress of hospitalization is hard for many children, but usually they have no problems when they return home. 3. After returning home from being hospitalized, children still feel they should be the center of attention. 4. Children do not feel comfortable in their home surroundings once they return home from being hospitalized. The correct answer is 1. Hospitalization is a traumatic time for a child, and it takes some time to readjust to the home environment. The child may regress at home for a period until she feels comfortable. Children normally do not dislike their home environment. In fact, they usually are eager to get home to familiar surroundings where they feel safe. A multigravida client who is 10 centimeters dilated is admitted to the labor and birth unit. In addition to supporting the client, priority nursing care includes 1. Turning on the infant warmer. 2. Increasing IV fluids. 3. Determining the client's preferences for pain control. 4. Providing client education regarding care of a newborn. The correct answer is 1. Nursing care for this client includes providing support, preparing for childbirth, assessing for potential complications, and providing for care of the newborn. Turning on the warmer is the best choice for providing for the care of the newborn. Oxygen and IV fluids may be indicated if variable or late decelerations are noted on the fetal heart monitor, but decelerations are not indicated in the question. It is likely too late for pharmacologic pain relief for a multigravida client. Education regarding care of a newborn is not appropriate at this time. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. The nurse prepares a client for lumbar epidural anesthesia. Before anesthesia administration, the nurse instructs the client to assume which of the following positions? 1. Lithotomy. 2. Side lying. 3. Knee to chest. 4. Prone. The correct answer is 2. Lumbar epidural anesthesia is usually administered with a client in a sitting or a left side lying position with shoulders parallel and legs slightly flexed. These positions expose the vertebrae to the anesthesiologist. Paracervical and local anesthetics are usually administered with a client in a lithotomy position. The knee to chest and prone positions are not used for anesthesia administration. A client is induced with oxytocin. The fetal heart rate is showing accelerations lasting 15 seconds and exceeding the baseline with fetal movement. What action associated with this finding should the nurse take? 1. Turn the client to her left side. 2. Administer oxygen via face mask at 10 to 12 liters a minute. 3. Notify the healthcare provider of the situation. 4. Document fetal well-being. The correct answer is 4. Accelerations are episodic and occur during fetal movement, demonstrate fetal well-being. Turning the client to the left side, applying oxygen by face mask, and notifying a healthcare provider are interventions used for late and variable decelerations indicating the fetus is not tolerating the induction process well. Nursing staff are trying to provide for the safety of an elderly female client with moderate dementia. She is wandering at night and has trouble keeping her balance. She has fallen twice but has had no resulting injuries. The nurse should 1. Move the client to a room near the nurse's station and install a bed alarm. 2. Have the client sleep in a reclining chair across from the nurse's station. 3. Help the client to bed and raise all 4 bed rails. 4. Ask a family member to stay with the client at night. The correct answer is 1. Using a bed alarm enables the staff to respond immediately if the client tries to get out of bed. Sleeping in a chair at the nurse's station interferes with the client's restful sleep and privacy. Using all 4 bed rails is considered restraint and unsafe practice. It is not appropriate to expect a family member to stay all night with the client. The nurse discusses the possibility of a client's attending day treatment for clients with early Alzheimer's disease. Which of the following is the best rationale for encouraging day treatment? 1. The client would have more structure to his day. 2. Staff are excellent in the treatment they offer clients. 3. The client would benefit from increased social interaction. 4. The family would have more time to engage in their daily activities. The correct answer is 3. The best rationale for day treatment for the client with Alzheimer's disease is the enhancement of social interactions, more daily structure, excellent staff, and allowing caregivers more time for themselves are all positive aspects, but they are less focused on the client's needs. When providing family education for those who have a relative with Alzheimer's disease about minimizing stress, which of the following suggestions is most relevant? 1. Allow the client to go to bed 4 to 5 times during the day. 2. Test the cognitive functioning of the client several times a day. 3. Provide reality orientation, even if the memory loss is severe. 4. Maintain consistency in environment, routine, and caregivers. The correct answer is 4. Change increases stress. Therefore, the most important and relevant suggestion is to maintain consistency in the client's environment, routine, and caregivers. Although rest periods are important, going to bed interferes with the sleep-wake cycle. Rest in a recliner chair is more useful. Testing cognitive functioning and reality orientation are not likely to be successful and may increase stress if memory loss is severe. You can get the NCLEX Mastery Bundle now. Link is in the description, or you can get it at alphanurseguy.com.